My name's Timothy Kukanovich. Palliative care is a subspecialized care that is focused on improving quality of life with patients with serious illness. That can range from anything from kidney issues to lung issues to brain issues, and a very common one is cancer. And our whole goal is to align the medical care delivered to patients with their goals and wishes, and the whole aspect is trying to improve their quality of life given their serious illness. Palliative care is for any patient at any stage of disease with a serious illness. And so we try to focus not only on the patient but also on the family, because whenever somebody has a serious illness, it not only affects the patient but the family members, social groups, and we try to alleviate their suffering, and I try to simplify it of increasing their joy and reducing their suffering. And that looks different for every person. So we got a card the other day from a family member that said, "You were there every step of the way for my dad. You were there at the beginning of the diagnosis. And even though his wishes maybe were a little bit different than most, medical care providers would keep coming in and saying, you have to do this, but my dad wanted something different. You were there to support that and to empower him through his whole disease process. And you were there on the hardest day of my life, which is when he passed away in the hospital." So getting messages like that, where we are there with the family members in their homes, in the hospital, in their care facilities. The story doesn't end when that patient dies, because the family members take it on for the rest of their lives. And so we're not only impacting, hopefully improving the quality of life, minimizing suffering and improving joy during that patient's life, but also helping the family members. And so we get these cards quite often, and it is a constant reminder of the powerful work that palliative care can do for not only the patients but also the patients' families. I've been fortunate to have worked in various medical systems. Truly, Augusta Health is focused on the community as well as focused on the patients. Not many organizations support such a robust palliative and transitional care where we go out to the patients' homes. We are able to see the patients in the hospital. Augusta Health truly stands by their motto and their mission of putting the community first. And I see that on a daily basis, where the needs of the patients come first, and Augusta Health really empowers us to do everything we can to support the patients where they are and provide them the best care possible.